All right, let's jump right in. Today, we're talking about a topic that every single person in medicine needs to have on their radar: odontogenic infections. These are infections that start in and around the teeth, but as you're about to see, they rarely stay put. To really get a sense of the scale here, let's just start with a number: 3.69 billion. What is that? Well, according to the Global Burden of Disease study, that's how many people around the world were dealing with oral health conditions back in 2021. It is a massive, and I mean massive, global health problem that often flies under the radar. And all of that brings us to the central question for this entire explainer. Picture this. You're working in the ER, a patient walks in with some facial swelling, says they have terrible tooth pain. So when is it just a toothache? And when is it a full-blown, life-threatening emergency in the making? Knowing how to tell the difference is absolutely critical. So here's our roadmap for today. First, we're going to really grasp the sheer scale of this problem. Then we'll zoom right in on the anatomy of the tooth itself. Think of it as the battlefield. After that, we'll get into the microbiology. Who are the players here? Then we'll trace the exact routes these infections take as they spread. And finally, we'll connect all those dots to the clinical clues you'll actually see in your patients and the huge systemic risks they carry. Okay, first up, let's really wrap our heads around just how common and how dangerous these infections can be. I mean, just look at these numbers from the US. They're pretty staggering. 1 in 4 working-age adults walking around with untreated cavities. Nearly half, 42%, of adults over 30 have gum disease. And by the time you're 65, almost 20% of people have lost every single one of their teeth. So this isn't some rare, exotic condition. It is incredibly common. And here it is. This is why this matters to every single clinician, not just dentists. These infections, they don't respect boundaries. They can literally break through bone and tissue and spread into the deep spaces of the head and neck. And when that happens, a dental problem instantly becomes a true medical emergency, one that can threaten the airway and become life-threatening. So to really understand how this spread happens, we need to know the layout of the land. We need to understand the battlefield itself. So let's talk about the anatomy of the tooth. All right, quick review. Every tooth has the crown, that's the part you see, and the root, which you don't. Deep inside, you've got the living pulp, full of nerves and blood vessels. That's surrounded by the main bulk of the tooth, called dentin. And then protecting all of it is the super hard enamel on the crown and a layer called cementum covering the root. Simple enough, right? But of course, a tooth isn't just floating there. It's held in place by this whole support system called the periodontium. You're talking about the gums, the bone, that special ligament. This entire setup is basically ground zero for gum disease. Now, this is a really important concept to get. The spread of a dental infection is not random. It follows a very predictable map that's laid out by our own anatomy. Things like how thick the bone is, where muscles attach, the fascial planes, these all act like highways and roadblocks that dictate exactly where an abscess is going to go. And this gives us a fantastic clinical rule of thumb. Let's take the buccinator muscle in the cheek. If an infection from a molar tooth breaks through the bone inside of where that muscle attaches, all the swelling stays inside the mouth. But if it breaks through on the outside of that attachment point, that's when you get that classic visible swelling on the patient's face. It's the exact same logic down in the lower jaw, but the key landmark here is the mylohyoid muscle. That's what forms the floor of the mouth. If the infected tip of the root is above this muscle, the abscess forms in the sublingual space, right under the tongue. But if it's below that muscle, it tracks down into the submandibular space, and that can be the gateway to those really dangerous deep neck infections we talked about. Okay, so it's not just anatomy, right? It's also microbiology. So how does this normally pretty harmless community of bacteria that lives in our mouths suddenly turn against us and cause so much trouble? This quote really captures the modern understanding perfectly. We used to have this idea that it was one specific bad bug causing the problem, but we now know it's a dysbiotic microbial community. Basically, the whole ecosystem gets knocked out of balance, and a whole group of bacteria starts working together, synergistically, to cause disease. And this shift in the ecosystem leads to 2 very different types of plaque. You've got the plaque above the gum line. That's mostly gram-positive bacteria that love to eat sugar. They're saccharolytic. And that's what leads to cavities. Then you have the plaque below the gum line. That's a totally different neighborhood. It's gram-negative, anaerobic, and these guys eat protein. They're proteolytic. And this is what leads to periodontal disease. So different location, different bugs, different diseases.
Okay, we have the anatomy, we have the microbiology. So now let's actually trace the pathways of infection. How do we get from a little bit of plaque to a full-blown abscess?
The road to a cavity is a pretty clear four-step process. It all starts with sugar. Bacteria, like strep mutans, chow down on that sugar and produce acid as a byproduct. This acid drops the pH right on the tooth surface and literally starts to dissolve the hard mineral of the tooth. And if that happens over and over, that demineralization creates a physical hole, a cavity.
Now, periodontal disease, that follows a different, and you could say a more insidious path. Here, it's the plaque below the gum line that kicks off a really powerful inflammatory response from our own bodies. And get this is the twist. It's actually our own inflammation that causes most of the damage. It destroys the tissues that support the tooth, it creates deep pockets, it dissolves the bone, until eventually the tooth itself just becomes loose. Now for the part that really brings it all into the clinic. How are you going to recognize these infections when a patient is sitting in front of you? And what are the big systemic risks you need to have on your radar? Think of this table as your clinical cheat sheet. So you've got acute pulpitis. That's the classic severe nonstop toothache that makes a patient jump out of their chair if they drink cold water. Then there's gingivitis. You'll see swollen, bleeding gums, but funnily enough, it's often painless. Periodontitis is that chronic, destructive version with the deep pockets and bone loss. And finally, pericoronitis. That's the classic infection you'll see around a wisdom tooth that's trying to come in, and it often causes trismus or lockjaw. And this brings us to what is a fundamental shift in how we think about this stuff. We can no longer afford to see periodontal disease as just a mouth problem. The chronic, low-grade inflammation it creates has effects on the entire body because bacteria and their byproducts can get into the bloodstream and fuel systemic inflammation. And if you want to see just how serious that is, look at this. This study looked at men under 60 and compared to the guys with the least amount of periodontal bone loss, the ones with the most severe disease had a hazard ratio of 2.12 for coronary artery disease. That is more than double the risk. It's an incredibly powerful, direct link between the health of your mouth and the health of your heart. You know, we've covered a lot of ground here, from microbes to muscles. So if you're going to take just one single central idea away from all of this today, what should it be? It's this: always, always look beyond the mouth. That patient who comes in with facial swelling or maybe a fever of unknown origin, you have to consider a dental source. An odontogenic infection isn't just a local issue, it is a potential systemic threat. And catching it early can make all the difference in the world.